Well, you've heard all the warnings, and it seems obvious, but it can be life-saving. What to do and not to do to stay safe over the steamy weekend. And the good doctor, Anuruddh Misra, joins us with some insight. Doctor, good to have you with us.
Thank you, sir, for having me.
You might have some people out there just saying, no, it's just, you know, it's just 100 degrees. But this is a big deal. Really.
It's completely serious. This is one of those scenarios where vulnerable populations are at risk for, I don't want this to be the outcome for anyone, potentially dying.
Yeah, and we're talking 117, 118 in some places.
It may not require to be that high in order for it to be potentially dangerous to the point of, you know, getting someone to the hospital admitted. So that makes us quite nervous.
Well, let's talk about some of the vulnerable people out there. Elderly, I'm sure,
certainly.
First, right?
Extremes of age, undoubtedly, yes. 65 and older, and certainly the infant, toddler, young child age group is more at risk.
And I guess the number one thing to do if you're going outside, it is Labor Day weekend, so a lot of people got picnics and cookouts, all that kind of thing. Drink a lot of water. Hydrate.
Hydration is a cornerstone apart from being out of the direct impact of the sun, which is to say, be in the shade. When we urinate, we can get an idea about how yellow our urine is. That gives us a sort of our own barometer about how hydrated we are or not. If it's particularly yellow or dark yellow, you need to be drinking a lot more to the point that it's more clear-like in nature or water-like, if you will.
So can you drink too much water? I guess
you can, yeah. So there's a danger in that as well. It's not likely, given this context of where we're always losing fluid when we blink, when we talk, there's always this loss. So the idea is to at least first catch up with that. In the context of this degree of heat, we're losing more by way of perspiration, so we need to catch up.
Heat exhaustion, heat stroke.
Sure.
The difference, and if you see someone, how do you treat it?
So heat stroke is the one that's potentially lethal, which is why I touched upon it previously. And that's the one where people's mental status tends to be altered or changed. That's fundamental hallmark differentiation between that and heat exhaustion. Usually heat exhaustion people can talk to you lucidly without any problems. Also, people who are in heat stroke, they generally have red, hot skin. I mean, it is really just on fire, and they have a strong bounding pulse compared to, in the context of heat exhaustion, usually these people have cold, clammy, sweaty skin, and they tend to have more of a thready pulse. And there are other things, but these are some fundamental things that we want people to know. And also, people who are in the context of heat stroke, that needs to be recognized and directed right away to emergency services.
911 immediately.
Don't even try to get going, because that's a very complex situation.
All right. Well, doctor, thanks for coming in. We appreciate your insights.